22 people who submitted proposals. So we have a lot to cover in the next hour. So I'm going to just go right down the list that we have according to how we received them. And then if you want to present, then just raise your hand and I'll call your name and then just raise your hand if you're going to be speaking. Okay. So after the meeting, just to give you an overview, after the meeting, we'll compile and organize all the proposals and we'll number them. We'll send out a draft preference survey by email. So make sure we have your emails and the summary, and then we'll see that the summaries are correctly worded for those of you who are presenting. And then after we get input on that draft survey, we will send it all to everyone, and we welcome you to share the link with anyone who can vote. So last session, the House limit was 5 bills for the caucus package. So if the same rule applies this year, we'll get the top 5 vote-getting proposals that the Kupuna Caucus will support and advocate for going forward. And so if your proposal is among the top 5, my office manager, Charles, will reach out to you on working on a bill draft. And if you have a bill, then that's great. We can use that as well. But as always, if it's not among the top 5, we still have it for everybody to look at. And we offer to have you introduce bills individually. We can do that to help you. And because the Senate has no bill introduction limit. So with that, if there are there any questions? Okay, we're gonna proceed on this long journey. The first one up is Savina Makalena on the Hawaii Family Caregiver Coalition and Give Me a Break. Is anyone here, Savina, or anyone from Family Caregiver Coalition? Okay, this one is a bill which requires the Department of Health and Human Services to make an amendment to the unemployment compensation qualifying question in regards to availability for work, with the purpose of allowing for the unemployed family caregiver to receive compensation, to receive job placement assistance and other social services in order to rejoin the workforce. Anyone want to add to that? Okay. All right, so that's the first one. Second one is Kurt Curio. I see you on somewhere, I thought. Independent Living Builders, Home Modification for Accessibility Act. Kurt? Okay, and this one is to incentivize people to modify their homes to give them a choice to age in place, improve for kupuna and physical cognitive diversive capabilities for safety, security, and accessibility of the residents. And this is a justification. Oh, Barbara, you unmute yourself if you want to speak on this. Okay, so I'm going on. Reduce. Oh, so these are
hold on. Okay. Sure. Hi, this is
people who aren't speaking. Just kind of.
I don't have it.
Barbara.
Okay, there. Can you hear me now?
Yeah, but somebody's. Kathy, can you mute yourself?
Yeah.
I think that's why the feedback.
Okay. Now we good?
Yeah.
Okay. All right. I'd like to address the bill.
Hold on 1 second. Kathy or oh, that looks like who's that at Kathy Wyatt's phone?
Yes, it's me talking.
Mute that.
Thank you.
This is muted.
Okay, that should work. No.
Maybe just turn this off. Maybe you should just turn this off.
Yeah, okay, that's better. All right,
Okay.
Barbara. Barbara? Oh, no, we don't have Barbara. Okay, sorry. Barbara? Okay, I'm gonna move on, but,
Okay, wait, okay,
Senator, we're here in the conference room. Kathy-
okay, Barbara,
actually, it's Kathy gonna talk.
oh, Kathy,
I'd like to address the bill that Savvy Macalena submitted to change the wording on the unemployment, the unemployment form that you have to fill out to apply for unemployment insurance.
uh-huh,
She has a father, I'm sorry, her mother has end-stage dementia. She was working for a company that, she was putting in 60, 70 hours a week for this company. And she had to come back to 50 or 60 because she had to take care of her mom and she got fired. So the unemployment form, when you fill it out, it says, are you available for work? And the only answer is yes or no. It doesn't give you leeway to say, I'm a caregiver and I can't work because I've got to take care of a sick family member. So that's what her bill is about, is to change the wording on the unemployment form so that caregivers can get unemployment should they lose their job because of having to caregive.
okay, thank you.
Okay,
So,
thank you guys.
okay, thank you. So we'll go to, number 3. So the second one that we talked about here was the home modification for accessibility. And Kurt, do you have anything to add?
Yes, can you hear me?
Yes,
Okay, so this legislative proposal is basically to offset the costs for Kupuna and those with disabilities to modify their home for accessibility so they can age in place. And one of the main reasons is, you know, the cost of healthcare, the lack of beds available, the shortage of healthcare workers, and you know, it's better for them, especially with caregiving families. Hawaii is a high multi-generational family there, and it's going to be one of the benefits of that. What kind of made me motivate to do this is one of my colleagues, we've been communicating for a while. He connected with Senator Christ on the federal level, and they submitted a bill for home modifications for accessibility. And, you know, my thought is if we as a state can spearhead this movement of having families age in place at home so they can live a longer, happier life, and yet offset the costs either by tax benefits or some other incentive, similar to how green incentive has been done with solar PV and all these other things, you know. But something like this is going to impact families directly rather than indirectly. It's going to be something that is a need. It's not a want, right? Because people want to age in place at home, stay at home as long as they can, and also take some of the burden off of the caregivers, the lack of caregivers, and the facilities that try to keep up with hiring qualified CNAs, RNAs, you know, especially in Hawaii where the shortage is larger than any other state because of the cost of housing and everything else. So this is my proposal, and I have a whole written stuff on it too, if I can send it in to.
so you have
to
a
later.
draft bill that talks about also the financing, whether it's
Yes.
tax credits.
So I'll email it in.
Okay, all right, very good. Thank you.
Thank you.
The third, next is from Senator Inoue. It's House Bill 1035, which was left on the table last session. It exempts medical and dental services provided by healthcare providers to patients who receive Medicaid, Medicare, or TRICARE benefits from the GT and applies to taxable years after this one. I don't think Senator is here, but the bill went through hearings and I think just left on the table. The fourth bill is Rick from Kupuna Caucus, Rick Tabor. Hearing aids. Rick, are you on? I'm going to move on, but this has to do with an awareness campaign to have hearing assessments along with annual physicals, and then some cost coverage of $1,500 per year hearing aid coverage for every 36 months. And I guess the Condo Association Ombudsman Program, he has he has a whole number of bills from Kupuna Council. The fourth bill is the Alzheimer Association Silver Script Program, a database list of mobile challenged individuals for first responders. And the fifth is first responder training on dementia best practices. A sixth bill is allowing professionals with out-of-state license reciprocity. So some kind of Hawaii license rule for allowing professionals for out-of-state license to practice here. So I don't see Rick on to explain any of these, so we will just list these, and if he comes in with something more specific, when we send out the list of proposals for you to vote on, we will get something more specific. Unless anybody here from Kupuna Council wants to add anything else to these 6 proposals. Hearing nothing from you, I'm going to move on to AARP, Audrey Suga Nakagawa, Family Caregiver Tax Credit, Disaster Preparation and Resilience.
Hi, Senator. Hi, everyone. Yeah, so the proposed legislation that we're looking at, the tax credit, it really expands upon the one that was passed last year. So there was an increase in the tax credit given to families who are caring for a loved one, whether they're children or adults. But the problem with that particular bill was that it limited the income level of those families. So what we wanted to do is propose something that would complement that, and that would expand it out to others in different income groups, especially the middle income, who could really get the tax relief for the cost that they provide out of pocket to care for a loved one. So that's one. The second one is the disaster resiliency, and we're looking to see what the housing committees are going to be doing and what HAIMA might be doing. But we really wanted to address about having better preparation, especially for our Kupuna, given the recent disaster where many of those who had perished in the wildfire in Lahaina were seniors. And again, seniors are the most vulnerable when it comes to any kind of a disaster. And so there is a bill that was passed in Louisiana that required all senior housing to have an evacuation plan for any type of disaster. Maybe something similar to that would be great. But this is what we were thinking that would be part of one of our priorities for next year. Thank you.
Okay, so Audrey, just a question then. So there are 2 bills that I think comes under ARP with you. Family Caregiver Tax Credit, which is what you talked about before, of what is that, paid leave?
Yes, it's no, it's not the paid family leave, it's a tax credit. We believe the other groups are going to be proposing the paid family leave, and so we'll let them take the lead on that one.
Okay,
And
so what is the family tax credit? You say there's a bill already that was left
there
on
was something that was passed last year. It was under the tax credit, and it was a loaded bill. It had so many parts to different type of tax credits. And so in there was a segment for the dependent tax credit, and it increased the tax credit from 2,500 to 10,000, but it limited the scope of the income of the family income that could qualify for this. So we wanted to have something that would expand it so that other income groups could also qualify for the tax credit.
Okay, and you have something specific as to what the scope would be.
Yes, we have some model legislation that we have seen from the other states, and we'd like to have that perhaps looked at as a possibility.
Okay, great. And so for the disaster preparation, that is more information kits for housing, senior housing sites, or
we do have a resiliency toolkit that can be shared with any community leaders who would like to look at that. But there are some very specific legislation that came from Louisiana after Hurricane Katrina, in which they required the senior housing complexes to mandatory have an evacuation plan and disaster preparation. So what I understand is that it's not mandatory here in Hawaii, but we really need to shore this up and make sure that everyone's ready and prepared for any type of disaster. In most cases, it would be a hurricane, but it could be something like the fire, So that is a possible legislation. And again, we're hoping to see, what the legislature is probably coming up with, because I'm sure this would be a very heavy topic for the next session.
Okay, thank you. So the next is Nancy Partika. Is Nancy on? Okay, this is a bill or resolution to require MedQuest to report yearly to the legislature and public on data relating to the 25.8 million released to MedQuest in 2022 for adult dental benefits. So it's access to dental care. If no one's there, I think Judy Moore Peterson is supposed to be on later. I guess she's got bills in too, so we can.
I'm on.
Oh, you're on.
I'm on, but I don't have anything to do with this particular, resolution. It's just asking us to do something.
Just
So,
asking you guys to do something.
yeah, exactly. It's just asking us to
Report.
provide reports that apparently Nancy Partika would like to see. So, but I don't have anything one way or the other regarding that request.
Great,
Yeah.
thank you. Okay, next is Harrison Peters Adult Daycare Association. This is to change the present staff to client ratio requirement from its present 1:6 to 1:9 or 10. The present ratio is lower than the ratio required of hospitals, long-term care, and assisted living facilities, I guess. And change the requirement does not allow adult daycare and adult day health to hire a person who has a red light restriction on their criminal background check because of DUI, although DUIs are not felonies. And their duties in our programs do not require them to drive clients. Lower or eliminate zoning and other requirements for adult care homes and adult care centers, I guess, to get licensed. More adult care and adult day health have closed over the 20 years that have been opened. And because of the requirements for zoning and other things that are so costly and time consuming to obtain and labor intense. So it has to do with regulations for expanding adult daycare and the regulations. And I don't know, Judy, if you have anything to say about that, but it would be a change in.
Yeah, we change in the Department of Health's licensing and yeah, those requirements and those regulations, which are not related to Medicaid directly. Yeah.
Okay, thank you.
Mhm.
Okay, so next is Senator Linda Coit on long-term care facilities for Kupuna, and she does have a bill and requires the director of EOA to work with healthcare providers to ensure there are sufficient long-term care facilities on each island of the state and has an appropriation. Next is, I see Nicole Wu, HCAM speaks, paid family leave. Is there a specific bill that you have a number or something from last time, or you've got a new bill or what?
Oh, thank you. Yeah, thank you, Senator Moriwaki. I see a lot of folks who've already heard me talk about paid family leave at other meetings. If I could just spend a second following up on what Audrey said about the family tax credit, because we worked on that last session. It was in the Governor Green's affordability plan, which was HB 1049. And in that bill, there was language to make the child and dependent care tax credit much better. It was going to increase the amount that people could get back and also the percent of the expenses that they could get back. Towards the end of session, the language from HB 1049 was moved into HB 954, and that's what passed. But unfortunately, I think kind of in the rush, only half of the language got moved over into the bill that passed. So last session, they quadrupled the amount that people could get back from $2,400 for one dependent to $10,000, and then twice as much if you have two or more dependents. What they didn't do was increase the percent that you could get and the income caps. And that's what Audrey's talking about. It's about moving the percent up and the caps up. So right now, the way the old language is, you could get 15% of your expenses back for people earning over $50,000. And then the most you could get back is if you're only making $25,000, you can get 25% back. The language that was in HB 1049 last year that didn't make it into the bill that passed would have moved it to people making less than 150,000 could get half of their expenses back. And then it steps down to getting 20% back for people earning more than $225,000. So really moving the income levels up and increasing the amount people could get. We talked to some legislators at the end of session. It seems like it really was just an honest, rush of moving language over. It didn't make it. So we heard that this would probably kind of just happen. Of course, we had a very different budget situation at the end of last session than now. So I'm glad that Audrey's picking this up as something that's important to basically just a little fix to add on to what was done last session. So I hope that's helpful.
Yeah. Just to follow on. So this part of it, the tax credit, there's language that you have that was left out from this past session's.
Right. It's in the original Green Affordability Plan, which is HB 1049. So it's a very wonky bill. If you need me to highlight it, I can easily send it over to you and your staff.
Yeah.
But if you look at HB 954 did pass, but only half of the child and dependent care tax credit language made it over into the bill that eventually passed. Okay. So as I said, we talked and it seemed like it was gonna happen this session.
Okay.
So now the paid family leave. Last session, you actually heard a bill, SB 360, and then it didn't make it through the session. The companion bill is HB 236. We'll probably be introducing something similar again in January, based on conversations with legislators. But paid family leave, I think a lot of folks think of it as maternity leave. But in other states that have passed this, it's more than just maternity leave, but it's for all different types of caregivers, including Kupuna care. So the leave would be for when you have a new child, adoptive parents, fathers, foster parents, but also if you have a parent or a spouse or a child that you need to care for because of their serious health condition, you would get some paid time off. Also, if you yourself had some serious health condition, you could get that time off. And then in some other states, they also have paid leave to cover military deployments and dealing with domestic violence issues. The United States is the only developed country that doesn't have some sort of national paid family leave program. My cousins in Canada get a year off or a year and a half, depending on the level of pay that they take. And in Europe, parents get 2 or 3 years off when they have children. So we really think we should be catching up to the rest of the world. And about 13 states have already passed this. So we're hoping that Hawaii will take a serious look into this and pass a similar program. I'm going to put into the chat a link to our Paid Leave Hawaii site, which has tons of information for people who have questions. Okay, I could talk about this for hours, so let me know what your questions are.
You said you revised the SB 360 or HB 236. Is there a revision, or are you just wanting that reintroduced, or what is that? The same thing, or are you adjusting or amending it a little bit?
We're hoping for something very similar. I think for us, it's been very much negotiating with legislators about what they want to introduce. But yeah, if we could get something like HB 236 introduced again, we'd be happy with that. It's sort of a Cadillac bill, like the highest ideal bill, and we understand that we would be probably negotiating from that position as session progresses.
Okay, great. Thank you.
Sure.
Okay. Next is Romala Radcliffe. Is Romala here? Okay, it's to remove the 6-month wait time for state and county retirees to be substitute teachers. Anyone want to speak on that? Okay, next is Katya Garrow, Thrive for Life. This is homeowners applying to make medically necessary modifications similar to the previous one we heard, but this is medically necessary modifications to homes to support independence and safety, like ramps and so forth, with an immediate exemption and not required to pull a permit from DPP as long as the work is completed by a licensed contractor, and a doctor. Anyone to speak on that? Okay, next is John McDermott. I see John, or saw John.
Aloha, Senator.
Hi, aloha.
So we have 2 bills that we would like the group to consider. One is House Bill 916. Last session was introduced by Representative Mizuno, but there was no Senate companion bill, so it didn't move. And that would increase the personal needs allowance for people living in a long-term care facility from $50 to $75. People who are on Medicaid, their entire income goes to the facility as their cost share, and all that they're allowed to keep is $30 from their Social Security plus $20 from the state general fund. And especially with younger residents who are used to having smartphones, because that is their lifeline to their friends, and it's their computer, and it's their photo album and things like that. That's $71 right there. So they can't even afford to have a phone. So I do have a list of other states and what they're all giving, and we're pretty much close to the bottom. So we would like to have a companion bill, same language that was already introduced, House Bill 916. And then the second bill is people who are in long-term care facilities and are being discharged have the right to appeal that. And during that process, many times nursing homes will bring an attorney, but somebody on Medicaid getting $50 a month cannot afford an attorney. And so we've had a really hard time finding pro bono attorneys who are willing to do this, because they're not going to make any money. They don't know the regulations. They really don't want to invest the time to understand the regulations. And so we would like a bill introduced that says that if a pro bono attorney wins the case, then the nursing home has to pay not only their attorney, but the pro bono attorney. And we think we might get more attorneys who are then willing to do this. But our real goal is that these things won't even go to court or to any kind of an administrative hearing, that it will motivate the facilities to work with the ombudsman and to try to negotiate some kind of a win-win, so we don't have to take that drastic action of kicking people out and into an IHS shelter or some inappropriate place. Thank you.
Thank you. Jamel Dulau, long-term care ombudsman program. Oh, this is the same one as you have, John, raising the personal need allowance to $75 a month. Yeah, okay. Okay, next is Stan Michaels, Department of Health, EMS.
Yes, ma'am.
Yes.
Can you hear me all right?
Yes, we can. Thank you.
Aloha, Senator and Representative, and ladies and gentlemen, thank you so much for the opportunity. Most people are aware that Kupuna fall injuries always top the list of serious, deadly, and yet preventable injuries in our state nationwide. In our Hawaii, every hour on the hour, 7 days a week, 24 hours a day, a senior is transported by an ambulance to an ER, an emergency room, because of a serious fall. That's just shy of 9,000 kupuna per year, and that's just too much. The pain and suffering is horrific. The cost in dollars in Hawaii is a staggering $220 million a year. 140 died, 2,500 are hospitalized. So for the past 6 years, we've been doing our campaign, which was nominated, I might add, by the NCOA as the finest in the nation. We were able to function, but our budget was drastically cut. So what I'm seeking is some support for the campaign that we had in 2016 that led the nation. We just do a tremendous job. Our volunteers are astounding, and we need to protect the Kupuna that have raised us, protected us, and they've created the citizens we are now. I have to admit that I are one. That I am one of the people that I'm speaking of, and as my phone goes off and does crazy things, I'll turn it off. Bottom line, we need some help with our PSAs, with our annual matching express bus posters. We have wonderful radio exposure. Volunteer pharmacists at Times, Foodland, Safeway, KTA, and the Big Line do a campaign where they review meds for free. All in all, the program is astounding, and we just need some assistance. So this request is for a $100,000 grant so we can get back to the support to protect the Kupuna we need. The carnage has to stop. I've been doing it for 19 years. I'm dedicated and passionate about how much. We put one grab bar in a bathroom, we win. We get one nightlight in a bathroom, we win. We just need some help spreading that word and making sure the Kupuna know they need to protect themselves a little bit more and watch where the hell they put their feet. We just can't have any more falls. So this request is seeking some fiscal support. I do not have a bill number, but thank you for the opportunity.
Thank you, Stanley. Did you have a bill before with this that you could give us some or additional data on just what you just said now?
No, I don't, but I'll be glad to work with your department or work in mine. My department is kind of swamped right now. We've lost
over the concepts and then the cost and what it would pay for. And you said that it's a grant, so you're just looking for $100,000 one year. That's it.
Well, I'd love it to be every year. So if we can make that happen in the legislature, it was that way for years, but some cuts occurred in the trauma budget, so we were left out in the cold. So I'd be more than happy to work with your staff to come up with a bill that makes some really good sense. I know there's a lot of people out there that have had a senior that have fallen. One fall, you take a family apart. One Kupuna who's helping a child while their parents work. If that person is broken, they can't care for themselves or the child. So the dynamics multiply. So we really need to help Kupuna understand they cannot fall anymore.
Okay, thank you.
Okay, I'll work with your staff if that's appropriate.
Yes. Yeah, just send.
Thank you, Senator. I'm so honored. Thanks for the opportunity.
Thank you. Ron Shimabuku, Alzheimer's Association.
Hey, Senator, thank you for the opportunity. I'm here. Would it be okay if I shared my screen?
Sure. Charles?
Go ahead.
Thanks,
Okay.
Charles. So, Senator, first and foremost, thank you for the opportunity to present here, as well as, the support that we had gotten this past session to really educate the public on this disease. So building off of that, what we're looking at proposing this year, a couple of things. What you see before you are two Kupuna that had gone missing within the last 6 months, yet to be found, unfortunately. So with respect to that, we are looking to propose the first thing being a Silver Alert program. Now, just to level set with everyone, a Silver Alert basically initially was specific to older adults with dementia who wander, or they have their cognitive impairment, really to aid in their quick recovery. So the quick dissemination of information to the public. And then also, so if you're familiar with the Miley Amber Alert here in Hawaii, so the Amber Alert is a federal mandate, it's funded federally, as opposed to the Silver Alert, which does not have any federal regulations. The Miley Amber Alert is specific to keiki, so keiki who have been abducted. So there is an office within the Attorney General's office called the Missing Child Center of Hawaii, who really is the program manager, the program coordinator for all the county law enforcement agencies, really to look at the Amber Alert program. Now, as far as Silver Alerts is concerned, because there's no federal mandate, the criteria, the program set across all the various states across the country differ. Secondly, the other issue that technically comes up as well is with respect to the number of alerts that go off. However, individuals that wander with dementia are typically found within a 1.5 mile radius of where they had gone missing. I will say that the Alzheimer's position has been a comprehensive approach to get information out to the public to aid in the safe recovery of individuals with dementia. Now, an interesting stat here. So just in general, 29,000 individuals we know of live with dementia here in Hawaii, of which 6 in 10 are prone to wandering. So 6 in 10 individuals with dementia are prone to wandering. Now, our research, and basically this is the homework that I had done in the past few months, shows here the population criteria that has been set for the various Silver Alert programs across the country. Now, you see that 21 states currently have people with cognitive impairments as their criteria for launching a Silver Alert. 11 states have added that developmental disability or the developmental impairment in addition to the cognitive impairment. And then Puerto Rico specifically has criteria for Alzheimer's dementia diagnosis. 18 states, including the district, have broad-ranging criteria. For example, age as a criteria, 60, 65 years or older can technically launch a Silver Alert. And note that Hawaii is currently the only state that does not have a formalized Silver Alert program in place. So as you can see here, there's a map of the United States of America. It's dated back to 2016, but you can see 8 states, including Puerto Rico, did not have a Silver Alert program in place at that time. I did some research and found that all except for Hawaii had implemented some type of Silver Alert program within their respective states. Now, what we're proposing is standing this program up within the Department of Law Enforcement, which is the new department agency coming up in 2024. We're in discussions with their leadership there, their directors, as well as their deputies to take ownership of this program and gain their support. So we're in continued discussions with them, great positive discussions. The criteria we're setting forth is really opening it up to adults due to the fact that we're seeing earlier and earlier onset of Alzheimer's dementia disease. As everyone knows on this call, it is not an old person's disease. So we are looking at, this being and not restricted to age. We're also adding in that developmentally disabled criteria to it. So we are working with the DD Council, the Developmental Disabilities Council here in the state, as this is a priority of theirs as well. So yeah, welcome to your feedback and thoughts on that. So that's our first proposal. The second proposal is tied to that. It's with respect to mandatory or required law enforcement dementia training. So given the fact that law enforcement, we are proposing that they manage and coordinate the program, and they will be the ones conducting the search, already doing so. We feel as if it's very important that law enforcement officers at least have the basics of recognizing the signs, how to interact with these individuals, communicate in the public, and ways to intervene in situations where they approach those with dementia. So that's our second proposal. Welcome any questions.
Terrific.
Okay, and you have costs on this and
Senator Moriwaki, we are working on costs. So we will certainly get back to you with regard to what that estimate looks like.
okay, thank you. All right, moving on then. Michio Tomioka from the University of Hawaii Healthy Aging Partnership. Anybody from UH?
Hi.
Hi. Oh, hi, Michio.
Hi, we're Hawaii Healthy Aging Partnership. It's a cooperative endeavor led by EOH, DOH, and UH to improve the health of Kupuna by offering evidence-based health promotion program. And we play a critical role in promoting evidence-based health promotion programs. And, but recent pandemic has significantly impacted our capacity. And, the pandemic has taken a toll on our resources and both manpower and financial. And we lost a lot of individuals who were the backbone of our program delivery. And this loss has strained our remaining resources, and we're now stretching every dollar to continue our mission. And so we wanted to kind of restart building our capacity to restart the program. I mean, we've been doing the program, but we want to continue to offer much broader sense. So we slowly reopen in-person classes, but this is just the beginning, and we need to rebuild our capacity to offer and promote our evidence-based programs more effectively. So we need your support to appropriate funds for Healthy Aging Partnership to recruit and train more individuals for instructors and leaders, and we can invest necessary resources and expand our program offerings. And it will also allow us to promote our programs more effectively and reach more community members who could benefit from them. So if anything else to add, Caroline?
You say you're seeking an appropriation.
Yes.
You have a budget, what that would be and what it would be for. You can send it.
Before was 550,000. And because of the cost is rising, we can, Caroline and our team will work on that amount.
I have to say, not to be a downer, but with Lahaina fires, we're looking at budgets maybe being curtailed. But if we look at the program and what the intent and what it's justifiable in terms of what it will do, and return on investment, healthy elders and aging base, put that forward, and then we could see where it goes. But just as a knowing that the situation has changed from last year. So the Lahaina fires have put us back.
Yes, we lost the Lahaina site because the site got burned, so we closed the class there.
Okay, well, thank you.
Thank you.
Okay, so moving on to Gary Powell, the Caregiver Foundation. Is Gary Powell on? Let's see. This is for the incapacitated or mentally ill individuals not able to appear in person to establish or renew an ID. So this is to get a method of using notarized affidavits from physicians, social workers, case managers, allowing them to vouch for the identity of these individuals. As it's so important to renew or apply for Medicare, Medicaid, Social Security, all the government programs. So it's really to enable notarized affidavits instead of having to go down and get your ID. Okay, no one to speak on that. Moving on to Donald Sakamoto, reintroduce SB 101. This is the Mobility Management Task Force. Donald, do you want to say anything on this?
Yes, Senator Donald Sakamoto, thank you for me allowing to speak on this important bill. Last year, I came to this committee to have you folks on support this transportation mobility bill, but unfortunately, they make it on the top 5. So you told me to go on my own, and I did. I reached out to Senator Lorraine Inouye, the Vice Chair of Transportation. She did SB 101 on this particular matter. And I reached out to Chris Lee, representative on the Big Island Transportation Chair for HB 415. Only HB 415 made it out from the House all the way to the Senate committees. It was a HB 415 SD2, and it had Department of Transportation to be involved in the coordination of the coordinators from Kauai, Maui, and the Big Island. So it didn't have any funding attached to the bill, according to Chris Lee, Senator Chris Lee, and Representative Chris Todd after I went to the committee meeting on April 28th of this year. So they said to introduce it back again. And I did have a meeting with Ed Sniffen, DOT, on October 9th. good conversation. I'm working with him to see if we can get with the counties first, to see if they're in support of this particular bill to have the coordinators. And if so, he would like to work with the legislature to see if we can get this bill passed. If not, we would just work with the counties.
Okay, sounds good. All right, thank you for your persistence and actually moving it forward.
It's my go for broke attitude as a
That's
son of
very good.
a second.
Yeah, no,
Move
that's what we
forward.
need. That's what we need.
Move forward and get the job done. That's why I
Yeah.
said in my testimony. So thank you.
Okay, thank you. Next is, next is Diane Tirada, the rent supplement program. Diane.
Hi, Senator Moriwaki.
Hi.
I just inquired if there was any intent to put funding into the budget to continue the rent supplement for the homeless elders that was passed last year. Because I don't know that they've actually implemented it, but I'm just thinking that if people are using that to maintain their housing, it was developed as a pilot program and if funding is no longer available after a year, they're going to end up being homeless again.
Yeah, we continue to support that. We see that as really important for as we see I think with the point in time information that Partners in Care did for Oahu, it was like a 27% increase in 1 year for the elders who are homeless. So it is a big justification to continue that. So we'll look into that. So rent supplement program.
Great.
Next is from Representative Pierick, resolution to reduce property taxes for Kupuna. Is Representative Pierick on? Okay. Next is Judy Moore Peterson, MedQuest, a couple of bills. Judy, you want to go over them? These were bills that were left on the table last session and you might want to explain it.
Yeah, thank you. Thank you very much. Actually, one of them was already brought up. So looks like we have some concurrence there. And I do want to note that right now, neither one of these bills are specific to Medicaid. They are rather they're related to DHS programs in the larger sense. They're actually in the social services division. So one of them that we also concur, we would like to see introduced or continue on is actually House Bill 916, but the HD1 version is the version that we it went the furthest, and it has some of the amendments that we would want. As was noted earlier, it allows individuals to keep more of their income, and it would increase it from $50 up to $75. It hasn't been increased in a number of years, and as was noted earlier, it's quite low. The other bill that we're also interested in, it made it all the way to conference, but then died. It was left on the table. Is House Bill 1357, the SD2 version. It would increase the state supplemental payments for care homes. I haven't updated numbers that what's included in that would be an increase from of what's included in the current bill would be an increase of $115, and we just the social service division did the analysis and they could support an increase of $132 from what it is currently. And that if it's up at that level, no additional general funds would be needed to increase that, and that would be about a 20% increase from what those care homes are receiving currently. And this particular in the state supplemental payments, they're set in statute and they have not been adjusted or changed in over 14 years. So I think this year is 15 years now. So, you know, obviously it's long overdue. And so so it could be increased by another $132, which would be a 20% increase for the care home operators for these state supplemental payments. That portion of it that helps cover things that Medicaid does not cover, like room and board, for adult residential care homes, community care, foster family homes, etc. So that's the other bill that we're also interested in.
So your text here that you sent in, it says increase of 115. Are you saying that's where you would increase it to 132?
That's correct.
It's higher than the 763 that was in
That's
the
correct. That's correct. If yeah, and again, we appreciate the SD2 version, and it would just need a couple of tweaks, you know, with an updated date, update a number, and it would be good to go.
Okay, great. Sounds very good and much needed. Thank you. Thank you, Judy. Any questions of Judy? I think Kathy Wyatt had one of these bills. Kathy, you've heard the two bills. Does that cover what you had submitted to us, the Medicaid reimbursement bill, or is that something else?
Well, I think it should have incorporated, it doesn't incorporate adult daycare. It doesn't talk about the need for increased reimbursement for them. So I don't think it's the same bill.
Okay. So I'm gonna, Judy, are you still there?
I'm here.
Yeah. So can you respond to that? Kathy is looking at Medicaid reimbursement for adult daycare centers rather than just the facilities. So
yeah, there were no bills. There were no bills from last legislative session that were focused on that were focused specifically on adult day programs, either day health or day care programs. There was a bill. Let's see if I can find it here. There was House Bill 222, the SD2 version. It had the last section was section 3 that included it just generically referred to an appropriation, and the appropriation was blank. It did make it to a conference as well. The first part of it, the first section, was changing some reporting rules for Medicaid for my program to do rate studies, etc. You may recall that you know, we've done a rate study. We've completed the rate studies for both for home community-based services. We've completed it for the adult day programs. We have an estimated amount, etc. We actually do have a budget request as part of the supplemental budget request process, because obviously the desire would be to have that make it into the base budget and not be needing to come back year after year to get the funds to sustain those increases. It is still going through that process, and so I am unable to speak to where that is or whether it will be supported in the upcoming budget time period in the governor's supplemental budget. But I will just note, as you noted earlier, Senator, that right now the budget situation is considerably different, and there's not much going towards anything new in this particular area. So if we wanted to increase on the Medicaid reimbursements overall for both care homes as well as for the adult day programs, if you took that sort of average increase that we had put forward, because we put forward a range, low to high, if you went with the average, it would be about $27 million of general funds. So we're not talking about total funds, general funds that would be needed. If it were the low end, it would be about 16 million. So big difference there of general funds that would be needed. That's not speaking to the federal funds.
So Judy, can you give us the fees the from your study and let's put it in a bill and let's see where you get with the admin budget request. And at least we'll have that as a placeholder on our side as to the importance of being able to support community-based services.
But we can forward to you
Just
what
the high-low end that
yeah, we'll forward to you what we have included in general, but we'll also include the range, the full range for each of the services, because we had in-home, we have the adult day programs as well as the care homes. And this is on the Medicaid side, not the state supplemental, but the Medicaid side. So I guess one of the reasons that we're at, DHS, that we're trying to promote House Bill 916 and 1357 is because those, at least 1357, would lead to increases for the care homes. It doesn't, as was noted earlier, it doesn't address adult day programs, but it would allow additional monies to go to the care homes without any additional general fund allocation. So that's one of the reasons that we're supporting that. But we're happy to send along the rate study and that range. We can resend you the legislative report that we did, and then we can add in the adult data.
Some language there that we could use as a placeholder.
Yeah.
Thank you.
Kathy, you want to say anything?
Thank you. I'd like to keep up with Judy on that though, and have discussions if we can.
Okay, and I asked Judy at the next meeting whether she could give a report on the great study and her plans that she's submitting. Judy.
Yeah, I mean so you're asking me, from what I put myself on video here. So what you're asking me is at the next meeting, which I believe you
December something.
December 1st or December
2nd, I think.
December 2nd. Yeah. If you would, you already asked me to present on the home and community-based services related
modification.
Our 1115 waiver that is out for public comment currently. The public comment period, while it ends on November 16th, we're happy to share what that's about, and we can provide an update at that in December. And if the desire is for me to also present on the rate study work that we did last year and that we did this year,
that would be helpful. Just put it all together
as well. Yeah, I'm happy to do both of those. They're very different topics, but I'm happy to do both.
Yeah, just in terms of community-based services, here's what you're modifying in 1115 waiver, and here's some fee increases that were coming.
And those are separate and distinct, but happy to cover those as well. That study as well.
Yeah.
Can do both.
Okay, great. Thank you.
Thank you.
Okay, that's the end of our list. Does anybody else have any proposals and did not submit? Okay, so
hi Senator Brad Knowlton speaking on behalf of Senator Inoue. I'm sorry, did I miss her submittal for reintroduction of SB 1035 relating to the general excise tax?
Yes.
Oh, okay.
You want to say something about it though? Yes, you did, and we did include it, but if you
okay, yeah, my apologies. It's pretty straightforward. It exempts medical and dental service providers by healthcare providers to patients who receive Medicaid, Medicare, or TRICARE benefits from the general excise tax.
Got it. All right. Thank you for stopping in.
Thank you, Senator.
Okay, so that's it, folks. What we're going to do now is take all of these and put it into a list like we do every year and send it out to our members, and you vote on the top 5, and then we'll collate that and come up with results at the next meeting. And as I said, the top 5, because the House is limited to their introductions, that's what we will be supporting as a Kupuna Caucus. But all of the other bills can go forward. And if you don't have anyone in either the House or the Senate introducing bills, we will be glad, or I'll be glad to at least have the Senate bills, and the top 5 will be introduced by, by Representative Hashimoto. I do want to, I thought I saw Representative Hashimoto on, wanted to have him say a few words. Are you on, Troy? Oh, he was on, and I see Representative Corey Chun is also going to co-chair. So we'll have a really good force next session. Representative Corey Chun is also going to co-chair on the House side, the Kupuna Caucus. So Corey, you wanna say a few words?
No, great job running the meeting, and there's a lot of great proposals. So I'm interested to see how some of these bills, come to fruition and get fleshed out, and look forward to working with everyone.
Thank you. Yeah, we look forward to working with you. And I see some other offices here. Representative Lisa Martin, Representative Jenna Takenouchi. Who else is on? So we've got really a good showing by the House, and thank you so much, and Senator Inouye's office, Brad. So if there, so there's an announcement on EOA, the Alzheimer's report. Or Debbie, are you going to talk about that? Yeah.
Sure, thank you. So we finished our state plan for Alzheimer's disease and related dementias. We just received it on Tuesday. So we are going to be having a kickoff meeting to invite people who are willing or interested in helping us to implement some of those recommendations that we have in the state plan. So the kickoff meeting will be on November 17th at the state capitol. Thank you to Charles and Senator Moriwaki for getting us the room. It's room 229. We also will have a Zoom option as well. It'll be a hybrid meeting. And so there will be a Zoom link as well. If you are interested in helping us work on implementing the state plan on Alzheimer's disease and related dementias. Oh, thank you. Tani is putting up the state plan. We have an online interest form that we want you to complete and fill in so we can get an idea of how many people to plan for this meeting on November 17th. So we'll put that in the chat, the online interest form. We'll put that in the chat. And here is the interest form, and we hope to see you at the meeting. And anybody who's willing to work with us on implementing this state plan. We do have monies from the federal government to do implementation. So yeah, we really are wanting to get started.
Okay. And Ron, you're still on Shimabuku. You have your walk tomorrow, yeah? So
Thank you, Senator. Yes, tomorrow, if you are free, come and join us. We kick off at 8:30 out at Magic Island. So if you're registered, if you're not registered, doesn't matter. Want to hang out, do a couple laps around Magic Island, please join us. I will take this opportunity to also mention our Maui Walk to end Alzheimer's, which will be on December 2nd, Saturday. It's going to be at Queen Ka'ahumanu Mall. So feel free for those in Maui to join us there as well. Thank you, Senator.
thank you. Anyone else with announcements? I do want to mention one thing. We've been working, Caroline Caderao, EOA, and I have been working on this task force on long-term care. And the focus has been across the country on workforce shortages. And we've been working on workforce development. So we're putting together a group that's working on workforce development and employment. And we are trying to organize a session where the national office, the Council of State Governments, will bring down resources to provide technical assistance so that we can really start moving the needle on workforce development and long-term care. We have shortages across the board, but we're, at the bottom of the totem pole in terms of healthcare workers and trained healthcare workers. That beds go empty because we don't have the staffing. So we're really looking at getting some help. So if anybody is interested in helping us organize, we will be meeting, and I don't know the date. But if you email me, we can put you on, and it's basically a brainstorming session on what is currently going on and what we need to get assistance from what's happening, best practices across the country, to fill in the gaps, and then involve both administration and legislators to start moving the needle a little bit more than we have in the past on workforce development. So if anybody's interested, please let me know. And Donald, you have your hand up. You have to unmute, Donald.
Yes, Senator Donald Sakamoto. I just want to let everybody know that there's going to be a senior affair at Windward Mall, Kaneohe, November 10th, from 9 a.m. to 1 o'clock in the afternoon. We have exhibit tables from Lanakila and other agencies. I belong to the Kaneohe Neighbor Board at large member there, and we're going to have a table, but please come out if you can. It'll be from 9 a.m. to 1 p.m. at Kaneohe Windward Mall. Senior fair for those Kupuna who want to come out and learn more what's going on. Yeah.
Okay, thank you. And if you look at the chat, Debbie put on the Alzheimer's disease and related disease plan, so you can get that online. So I think with that, if there's nothing else, I'd like to just say thank you, everybody, for your patience going through all of the proposals, and we look forward to working with all of you. And the next time you'll see the results, and also hear from Judy Moore Peterson on community-based long-term care services. Thank you all. Have a good weekend. Aloha.
Thank you.
Thank you. Thank you.